wanted to, today I'm doing 3 medicines. I had 4 of them down, but the other one I'm going to do Monday, wild elder. That's an Aurelia hispida and Aurelia racemosa. Those are two not very big medicines, probably not well used, but you know, just to keep with what I've been doing, I could go through the polycrest, I could go through all that, but I basically want to hit every medicine in the book so that I can have a, you know, thing of it in my community. So if you ever decide to like, hey, let me look at this medicine and see what's up with it. And at the end of this, I want to do some case taking, the people that you encounter with different types, and that's more where health coaching comes in rather than homeopath. So yeah, so the health coach and stuff helps you to uh, you mirror, you match them, if they come in with uh, a depressed energy and you come in all excited and that doesn't work. You have to come in and match their energy, and then you lead their energy back out into where they're now doing better, or you can go in and shock them, you know somehow. I don't, yeah, there's a few techniques that you can use to just shock them out of it and, get them smiling and thinking, thinking differently. So, all right, Aqua Pura is the first one. Alchemical water, alchemist's water. Yeah, I tried looking that up. I do not know what they're talking about there, but they made this water. Let's see, Aqua Pura has been used for broken down constitutions and hopeless cases. Tincture and all potencies. So this, I guess, was potentized. The next one I don't think was shortness of breath, exhaustion, multiple allergies. So, just like aqua marina yesterday, which is seawater, it has that. Seawater was good for reorganizing the blood and stuff like that, immune responses, different things. Just to uplift the person. Let's see, constitute hopeless, shortness of breath, exhaustion, multiple allergies. So this is one with all kinds of allergies, all kinds of cancers, chronic fatigue, lung weakness, kidney failure. Now, I don't know how much it was proven. You got a lot more with aqua marina. Now, this aqua pura doesn't seem like it was proven all that much. So, but anyways, almost the same things as aqua marina. And I have Pagosa Springs, he called it. And that's just basically the waters in Pagosa Spring. Now, a lot of these waters, like sea salt, you think seawater, you think it's got the salt, it's got all the minerals, it's got a lot of stuff like that in it. So you're actually potentizing all that stuff. Same with Aqua Pura, alchemaic water. I don't know exactly how they did it. They must have distilled it somehow. And then, uh, you know, they Pagosa Springs. That's what I was trying to think of. They have, that has all those minerals from that Pagosa Springs. There was one in Germany. I did one in here. It was from Germany, hot springs, that they potentize. So, anyways, the next one is Aquilegia Vulgaris. Aquilegia Vulgaris, huh? You're gonna like it. It's a plant columbine. It's in the Ranunculae family. Tincture, fresh wild plants. Okay, Hansen gives the following indications for this unproved remedy, a drug. Clavis, hystericus during menopause with vomiting of green substance. So they got that hysteria, which they would, I imagine, rip out their uterines, to cure it. But this one has vomiting of green substances. Now, there's a few medicines that have that in flus and things like that, but a hysterical woman during menopause. Hensing, okay, especially in the morning, globus hystericus. So they wake up and they're just, rah, ready to go. Sleeplessness, nervous trembling of body, sensitive to light and noise. That sounds like Nat Murr. Dysmenorrhea of young girls, menses scanty with dull, painful, nightly increasing pressure in the right lumbar region. Woman at menopause, another one, with vomiting of green substance, especially in the morning. And like I said, they have clavis hysteria and dysmenorrhea, insomnia, these kind of things going on, and that is Aquilegia, yeah, that's what it is, Aquilegia vulgaris, which is columbine. Okay, Yeah, Aragallus Lamberti, which is white loco weed. Not the loco weed everybody grows with Smokies days. Let's see, tincture and all potencies. So this one has been um, proven, I would imagine. Aragallus Lamberti. These must be Italian ones, Italian plants or something. Acts principally on nervous system, producing a bewildered, confused state. Symptoms of incoordination and paralysis. They can't move. They're incoordinated. They really got to concentrate on walking. Tired in the morning. Diplopia. What is diplopia? Burning in the eyes. Cracking of the lower lip and locomotor ataxia, which means they have a hard time walking around and getting going, and they really got to watch when they walk because they have a really hard time at it. And it comes with paralysis too. It can come with paralysis. Man, diplopia. I should have looked that up. But see, a lot of these words, diplopia, you really don't need to know. Double vision. Okay, so double vision is diplopia. Interesting. All right, so diplopia, burning in eyes, cracking in lower lip. Okay, Great Depression, worsen morning or evening, cannot study, mental confusion and apathy, desires to be alone. So that's that depression. They want to be alone. They're having a hard time with their thoughts. Difficult in concentrating mind, absent-minded, lack of ambition, restlessness, and aimless wandering. They're cross, irritable, restless, and a three is bewildered. So these people are just like confused in life. And that's where diplopia, locomotor ataxia, and paralysis is the clinical of this medicine. White loco weed. Let's see. Lungs must concentrate his mind on walking. Limbs, I mean. Lungs is next. Weakness of limb, pain in left sciatic nerve. I have that. Cramps of muscles on front of leg while walking. So they walk and they have cramps on the front muscles on the front of the leg. Weight on chest, on region of ensiform cartilage. So there's constriction on the chest, as of a white band, like something squeezing it. Feels like a weight, a band. Soreness of chest under sternum with oppression. This can be in flus, colds, anything like that. Okay, the throat aches, feels full, sore with nausea. Pharynx is dark, so you look down into the throat and it would look dark. Swollen and glazed. Dark, swollen, and glazed. So obviously they have throat stuff going on with chest stuff going on. So this sounds like a flu, cold, whatever's going on there. Like I said, Aralia hispida, which is wild elder, will be Monday. And that'll go with American spikenard, which is Aralia racemosa. So today's was Aquilegia Vulgarus and Aqua Pura and what's the other one? Aragallus Lamberti, local weed. All right, so that is the three medicines I wanted to talk about. Yeah, it's diplopia, double vision, diplopia. They got diplopia, they got dyspnea, they got dyspepsia. Dyspepsia is like a heartburn. Dyspnea is you can't breathe. Now diplopia is the double vision in the eyes. Did I need to know he has double vision? I don't know. If someone said they had double vision, and I was looking up medicines and I saw that word, I might look it up. I might not. I most likely got enough other symptoms that would help me. But if that double vision was there, then diplopia would be something I'd be happening to look up and consider. Anyways, the important part, case taking, the types of patients. You have a closed patient, an open patient, a hypochondriac, and an intellectual. Closed patient, you need to be sympathetic, receptive, gentle, drawing them out. So you want to gain rapport with them, and like I said, you don't come in, blah, 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 and all, talking loud, and you're all excited, and they're all depressed. You come in, and you match their energy, and you ask them how, what's going on, and they start, just to get them to talk. And if they don't say nothing, they say, oh, I'm fine. or, because someone made them come to you. But I'm fine. And if they're saying they're fine and they got a major injury, arnica always says, I'm fine. Leave me alone. I'm good. So you want to draw that open patient, draw them out, draw them, ask them nice, simple questions. And you're going to have to keep asking this one lots of different questions. How's your back? How's your neck? How's your, because this person is closed, and they just are not going to be given a whole lot of information. So you're really going to have to draw them out. Now, and that's not a hard one. You have to be sensitive in areas that, basically you touch on something very intimate to them. You want to back off when you notice that they're getting, they're closing down more. You want to back off and go other ways, and then slowly hit that a little again here and a little there. And a lot of times, like Robin Murphy would say, it's a, when I'm reading his stuff, it's a, this patient would come back on the second visit and talk to, and something comes up that they didn't tell me the last time, So yeah, that's, a lot of people have things that they really don't want to share with others. Think about it. Like, I got hemorrhoids, or I bleed out of my anus. These are things that are like, ooh, but yeah, things you got to pull out of them. I have leukorrhea that's very smelly and dark colored and whatever. And it's like, especially a closed patient won't do it. Now, an open patient, they'll start throwing all kinds of crap on you. You got to keep them online. You got to keep directing them to where you are. They'll start talking. They'll get off on a tangent. They'll tell you about this and this and the other thing. Oh yeah, my toe and my finger and my head, and So you got to draw them back. You got to help guide them and focus them into what's going on. What's the real situation there? Now the hypochondriac. That's you got to be careful what you say to them. If you say something like, "Do you have?" You have a hard time breathing. Oh yeah, all the time. They'll go for it. They can have everything that is under the sun. So anyways, you've got to watch what you say by just leaving. Of course, you're scanning. First you scan, then you the probe is last. Analyze. You scan it. When you're scanning, how are you? What's going on with you? What'd you come here today for? What, get them started. And then as they go off on the tangents, what's your chief complaint? And then from that chief complaint, you can determine, is it a liver thing? Is it thyroid? Is it this? Is it that? And then you can start getting other things, but they will say they have everything. If they were to read some of the books on homeopathic medicine, they'd have everything in there. So you got to be careful what you say. You got to lead them. And the intellectual patient, you have to constantly filter what they tell you. So in other words, they studied their case, they know what's going on, and they will come and tell you what's wrong with them, and what they should do and all that. They already figured out what was wrong. The intellectual and the hypochondriac. If it's an intellectual hypochondriac, that's the worst patient. He's got everything and he knows what's wrong, and he's going to tell you how to fix it. So, these are the types of people that'll come into you. And like I said, that's why the first thing is our attitude. I think I went over that yesterday. Was that yesterday? Yeah. No, day before. Wednesday. Wednesday, I went over there. Our attitude. When we come in, we need to have our energy right, make sure we're centered, so that when we come in, we can match their energy and draw them out. We can determine what type of patient, what type of person they are. Are they real closed? They're not going to talk. These are easy. Open, closed. Open, we'll just start talking. Hey, how you doing, doctor? Closed, will be just sitting there. Yeah, maybe. So the hypochondriac, I got everything under the book, and the intellectual's telling you, yeah, and I know how to fix it, and this is what's wrong, and this is what we got to do, and so you got to rein all these in, and basically, but like I said, the intellectual hypochondriac is the worst. But each one has their own, personality, constitution. So what you're doing is they come, someone comes to you. Now, my wife's legs, they seem to be fine now. I rubbed them a couple times, but I hadn't really had to rub them. She usually would come in and, I'd just wake up at 3 or something, take a leak, and she'd come in and throw her legs at me, and I'd have to rub them. That doesn't happen. And I even asked her, first time I asked her yesterday, how's your legs? Now I've given her calcarb, I've given her Ruda, because she has a bump on her foot, so I'm thinking tendon. So I went after Ruda, I went after that with that. It don't seem to do it. Calcarb helped the pains. Now that just palliated it, it seemed, because they always came back, when she stopped taking the medicine. So now I'm considering, okay, this has got to be an acidic thing. If I look at her, how she lives, drinks a lot of pop, eats a lot of carbs, pancakes, rice, no vegetables, doesn't get anything to neutralize the acids. And I kept starting to think, is this an acidic thing? Because like down here is the bladder, the points that I push on is like the bladder points and different things like that. That's shiatsu stuff. But anyways, so I'm pressing, I'm thinking, this seems like it's an acidic thing. And I was thinking gout, and gout, forms on the bones, and she doesn't have none of that. But this formed on a tendon, I guess it is, a ligament, maybe a tendon. I don't know which one it is, and like I said, well, I asked her yesterday. She said, oh yeah, it feels better. And I'm able to actually even put my hand on that bump on her foot. Before I couldn't even, she wouldn't let me go near it. I've even squeezed her feet, which was a no-no. So anyways, now is this just taking the pain away? Is this going to, now this is a long-term thing, if you ask me. I've got to counteract all the soda pops and acids and things. And why did I come to it? Because that phosphoric acid is what I gave her. Said, and I tried phosphorus, I think. Yeah, I've tried a couple medicines. She's a NAPMER. I tried her constitutional remedy just to see. Yeah, nothing was really hitting. The calcarb took the pain away somewhat. So anyways, the phosphoric acid is, it said big bold letters. Where is that? Phosphoric acid said it was, they like soda, bubbly stuff, bubbly pops and that. And that's phosphoric acid they're using to make the bubbles. So we're going to see. It's the first time, though, that I've had her. I asked her yesterday, I said, how's your legs? And she said, oh, they're fine. So the doctors, I said, well, what did they say to you? Did they say anything? No, they just called doctors and said, I never seen this before. I said, did they come up with any treatment, tell you anything? No, they had nothing. So I don't know, that's weird. Why didn't they try giving her some drug or something like they usually do? Anyways, so like I said, you're gonna do the scan questions. What are you coming in for? All these different things, likes, dislikes. You can scan things and see where they're at. Then you go in and analyze what you scanned. And if it's a closed patient, you don't get much to scan. Now you got to go into just probing. To really ask questions. What are you? Okay, what are your likes? What are your dislikes? What makes that feel better? What makes that feel worse? You're gonna go in and probe it. But if you do get scanned stuff, you analyze those scanned things, see what's important, what isn't. You're underlying on them. One underline is not so important. 2, it's more important, and 3 is a big one. 3 most likely comes down to the center of the case of the person. Okay, so let's see. I wanted to get into. Oh, okay. So he talks about a hypochondriac, and this is very good for the different ways that you differentiate between remedies. Is it the worry of calcarb? So calcarb is a worrier. They have anxiety about their health because they worry that if something goes wrong with their body, they won't be able to do something. They won't be able to perform. They won't be able to function. So that's the worry of a calcarb. They have a feeling that they're going to get behind on something. They're not going to be able to keep up with the demands of life and business and whatever. Now, the arsenicum hypochondriac has a fear of dying and death, fear of suffering. So that would be anxiety. If you heard that in a hypochondriac, and they were, you would right away be considered an arsenicum. If they were worried that oh man, I can't, I have to get this ankle fixed or this thing done because otherwise I'll fall behind and so that's that fear there at Kelp Carb. So this is how you're thinking of medicines when, the medicines that you all have in your mind will have in your mind once you start learning some of them, and it's not hard, I mean, you could take a remedy a day like I'm doing. Take a remedy a day and say, oh, that's got anxiety and fear, keynote, and that's what I give you in my community. All right, let's see. The lycopodium has anxiety about health because of their appearance or their image. Like they don't want to appear weak. They don't want to appear, they don't want to have wounds or cuts or problems. They want to appear like everything is good. That sounds like someone I know. So they're afraid. They have a secret fear of having a nervous breakdown and making a big embarrassment for themselves. So that's the lycopodium. They're embarrassed. Nitric acid patient, hypochondriac, has anxiety about the health because of negativity about life. So constantly criticize and question. They're never happy. That's another one I think that person could use. So this one is just always negative. It has a syphilitic element with depression and pessimism. So the nitric acid patient would be pessimistic. Nobody does anything right. I have to do everything, And then, some of the coaching questions are, really? You have to do everything? Nobody does anything? These questions, well, they yell, but they're not, So yeah, so you got it's a real interesting play when you start talking to people, because some people, and that's a symptom, they don't even want to talk to you about it. They don't want, you try to get a symptom. Oh, why you got to keep asking these questions? Well, that's a symptom. you know all right, that's the nitric acid one. They're just negative about everything, man. I know a person who I'm gonna give that to, my mother. She Nobody does anything right and everybody's wrong. Lycopodium or nitric acid, that's a toss up there, buddy. She just badmouths everybody and is always miserable. Every once in a while she's happy, but not often. And she always does want to keep up the appearance because she had a rough life when she was young. So she wants to keep up the appearance. Everybody's fine around her and everything's fine. And then the other end of it is she's negative. Everything isn't so fine according to her, and basically she needs to put them down. If she puts someone else down, then it's not her fault, and that's and you just recognize that. Once I took health coaching and that, I'm like, ooh, I can see things in people. In me too. So another hypochondriac remedy is Kali arsenicum. It has panic attacks for fear of losing control. So a lot of anxiety in their stomach and abdomen, and they have panic attacks, and they fear they're going to lose control. They're not going to be able to maintain the life that they are doing, or they're not going to have the appearance. The appearance is the other one. So let's go over them again. Kelp Carb is worrying they'll get behind. If they get sick, they won't be able to accomplish their goals. Arsenicum is they're materialistic or oriented, but they fear suffering and they fear dying, fear of dying and death. I think aconite is they fear they're dying now, but arsenicum is their fear of dying. They're materialistic and they fear they're going to suffer. Lycopodium has anxiety about their appearance, their image. How do they look to everybody? Nitric acid has anxiety about and they're negative about life. They're pessimistic. Nothing's right. Nothing ever goes right. And Kali arsenicum has panic attacks, fear of losing control. So they are always having a panic attack that they're going to lose control of whatever they're trying to control. And that's Buddha. He says, our desires is what is killing us. Let's see. There's a phosphorus anxiety. So that last one, which was Kali arsenicum, has they can have asthma attacks. So that's another fear that's there. They have this panic attack, this asthma that kicks in the asthma attack. Kali arsenicum would be considered for that. Phosphorus is another one that has anxiety about their health. Phosphorus is a naivety, naive, anyways, impressionable. Um, whatever they read, they believe they have it. Oh, that's phosphorus. Whatever. That's why I say you got to be careful with this one, because they read your uh, materia medica or anything. They read any articles on health. They will basically feel like they have it. Hypersensitive to their environment. So this is a hypersensitive hypochondriac. You want to get, you want to think of phosphorus. They have, they're like a pulsatilla with the changeable symptoms. Symptoms change around, but not quite. That's why you can never get a clear remedy picture from it. But they're hypersensitive to their environment, so they probably have a lot of allergies and things like that. Pulsatilla usually changes in a pattern. Phosphorus is very impressionable, very gullible. So phosphorus changes their patterns, the pains and that switch around. Phosphorus is very gullible. How's your knee feel? Oh yeah, that's killing me. They never had a knee pain before, you know. It won't be that drastic, but they would start, if you, with that hypochondriac, if you were to suggest them having something, they would have it. So that's the different types of anxieties and fears that people come in with. And you think about it, that Indian homeopath that I was talking to, taking care of that cancer with a few different people, he hit a lot of emotional and mental stuff. And a lot of times these diseases and that can be quite a fear in someone's life. So when you're coming in, that compassion has to be there for what they're going through. Someone comes in with cancer, you can't, oh, you did radiation, what are you nuts, shouldn't do that crap. And that's what he said. That guy, that homeopath from India, he said, the guy came in, was doing well on bryonia, case was moving along, 3 months, I don't know how long, but he was, energy was better, all, things were getting better. He was looking better, looking healthier, feeling healthier. And I don't know if it took care of but he had the cancer of some organ in there. And anyways, he went to the doctor for something, and he told him about the cancer, and he said, homeopathy's been doing good. They did tests and all that. It's been doing good, but let's give you chemo or whatever, they radiate him. I don't know what they were doing. And they did that, and he got weaker and worse, and then died. So I'm not encouraging people not to utilize the medicine, but you really need to take control of your health. That's why I say arm yourself. That's my motto. Arm yourself. Have the information you need. Have the Tony did that. Tony Robbins. He said, you got a big tumor or whatever on your gland, and that's why you grew so tall, and that you got to have that surgically removed, the surgeon says. The other one says you got to have these drugs to make sure, not you'll just be dopey. He said, I can't do that. And so they said he got a high amount of HGH, which a lot of weightlifters, they want that to build their muscles up. But he did his research, and he didn't do nothing. He basically, I don't know, he does a lot of interesting health stuff. But anyways, arm yourself, know what's going on. Don't just take them as God. Okay, you're gonna burn me with the radiation, let's do it. I used to work in nuclear plants. Finally my wife said, you want the job or us, because it was travel. I got out of there because I don't know what that stuff's doing to me. So anyways, and when I say arm yourself, have a diet that is conducive, not all this crap that they show on the TV. They got pizza and hamburgers and all this crap. Then they got a drug after that for the pizza and hamburgers that you're always eating. What a vicious cycle. Start taking control of your diet. Come into my community, man. Learn some homeopathy. If you're losing your Medicare and that, you need something. This stuff is inexpensive, very inexpensive. Not real hard to use. You get some keynotes. It could help you through some major crises or minor ones. And then also your movement. What are you doing in a day? You sit in a chair all day on a computer with that crap in your eyes and not moving? Or do you get out and go in the woods like I do and run through the woods and pick mushrooms and pick plants and learn the plants? And now, I'm just incorporating the plants from my local woods into my diet. Mushrooms, plants. I just fixed that dang thing. One day I'll have a great setup. But for now, it works. All right, that's morning medicine. We will see you Monday. Have a great weekend. Take care of yourself. Do something good for yourself. Because if you don't put on your oxygen mask first, you can't take care of others when the plane's going down. All right, that's morning medicine. You can age, but you don't have to get old.